Thanks to the organizing committee to arrange such a fantastic program. Yes, I have the slides here. Effective, proactive, and preventive healthcare is a team sport. Remember, it's a team sport where the doctors, dietitians, clinical staff, patients, and their relatives, they all need to come together and be responsible for the health. The health has to be a business of the patients and the relatives as well, and not only is seen as something which is done in the hospital walls, and that is what I'm going to talk about. By connecting all parties involved in health, what we try to achieve with a digital platform is to connect them and to make the care available in a coordinated manner. But I'm not here to talk about Cordia, the digital platform for chronic disease management, but I'm going to talk about this wonderful topic that we have today, that digital health, is that a hype, hope, or reality? Yes. So the question is $1,000,000. Is digital technology, how good is it? And how can we use it in our daily lives to make effective and better clinical outcomes? My name is Khushboo Verma, and thanks to the introduction, I have been part of this journey in digital healthcare for 22 years in Denmark, in US, UK, Finland, and India as well now. And in my experience, throughout experience, you can imagine what is the answer that I'm going to give in relation to this question. How do I see digital health? I've seen this transformational journey from actually paper-based healthcare to digitized healthcare, and from digitized healthcare to digitalized healthcare, and then moving towards artificial intelligence multiple times in multiple countries. And we are here in India, we are here on that journey. We started recently, and we are long way. I would say if I compare the speed and the tempo, we have a much better tempo and adaptability as compared to many other countries that I've worked with. I'm also a member of political network in Denmark, which determines digital policies and in advisory capacity. And I'm also a member of India-Denmark Chamber of Commerce, which gives me the opportunity to bridge the two great nations together and bring the learnings and exchange the learnings from each other. So before answering the question that how do I see digital health technology, I would like to make these phases of digitalization. What are the basic phases of digitalization? The first one is digitization of records, where we move from paper-based records to electronic records. This gives huge accessibility. It solves a lot of problems in relation to erroneous record keeping and all. But there is a problem. It creates data silos, and that is also something. This is a step which is very important, but it doesn't solve all the challenges. It kind of increases the challenges somehow. The next phase is integration of systems. Like how do we integrate these different data silos together so that they can exchange the data and talk to each other? And that increases the interoperability, that increases ease of use. And that is where we want to be. If we have an EHR system which is not talking to all other systems in the hospital or in the clinic, then it becomes a burden to transfer data from each other and so on and so forth. So how to make this interconnected ecosystem is the key to succeed with digitalization. And the last topic is, or the last phase is patient-centric innovation, which means that how do we bring the patients in the system instead of just thinking of clinical and administrative systems? How do we bring the patients inside in this ecosystem? How do we bring their relatives as well in this ecosystem? So, and that is where we gain the win from digitalization. But these are steps more or less sequential. If done smartly, the third step can be done as the first step, but there has to be a good thinking in the way we develop the technology, we use the technology as well. Now, when I say patient involvement increases the gains of digital health, what is patient involvement? How can we involve the patients in systematic way? I'm bringing this topic because this is very close to my heart. First of all, I have been an advocate for involving the patient and engaging the patient throughout in all these digital implementation that I have talked about. The first step is to inform the patients. And I think today, in today's world, there is a good information sharing between the doctor and patients. Even though we lack time as clinicians here in India, it's still the information sharing is going on. What my experience from Denmark is that there used to be healthcare was like a black box which used to just ordinate medication prescriptions and not inform the patient in the, and I'm talking about 20 years ago, about what is happening in their health and what will happen if they take this medication. But now that information sharing is much better, much transparent, and patients are being actively part of that. The second step is engage the patient. When the patients are informed, how do we engage the patients in their own healthcare? Like, what do we expect out of them? Instead of coming as a car which is broken to a workshop, gets repaired, goes back home, and then again behaves the same way, how do we make them equally responsible in their health? So that is the second step in patient engagement framework. The third is empower the patients, meaning that how do we make them so aware? We exchange so much information that they are empowered to take the decisions on their own. And which includes, for example, if the patients are aware and empowered, they can themselves like use the platform that Dr. Inge talked about, and then Dr. Devasish as well. How can we empower them so that they can take charge of their health? And that needs a lot of awareness. The fourth step is partnering with them. How do we see them as equal partners? And this is where, to an extent, in some areas, we are in Denmark now, where we see the patients as equal partners. And they are equally active in making decisions about their health and about their health services. The last part is supporting the community. Like, how do we involve the community to take care of the patient, and how do we inform the community so that prevention can happen? Instead of just reactive care, we can provide preventive and proactive care. So, to the clinicians here in the room, there are some important considerations when we are thinking of health technology and digital technology. These considerations, these are some points. It's much more than that, but in the interest of time, delegation is one thing. Health technology should not be a burden on you. It should provide you opportunities to delegate some of the tasks from your table to either to the technology or to the people involved, to the parties involved. Ease of adoption says it itself that it should be easy to adopt, and it should not take years to implement an EHR system. It should be very easy, quick to adopt, and also for the clinical staff's sake, their time. Interoperability, platform approach. Instead of solving one problem at a time, think of platform approach which can contain solutions to multiple problems instead of just one at a time, because then you have multiple smaller systems which do not interact with each other, and then it becomes chaos to maintain them. So, and all of this is coming from experience. Configurability, standard solutions, out of the box solutions, they also pose some problems because every clinic has their unique workflows, every clinic has their unique ways of working. I think the technology needs to respect that instead of vice versa, and technology can respect that if done properly. So configurability and flexibility is a key element. Data privacy, of course, we are dealing with health data. Industry standards, yes, because soon there will be regulatory requirements coming also in India, and we don't want systems implemented which are not compliant to regulatory compliances and requirements. So these are some of the considerations. There are many more, but for now. The future of healthcare is digital first, and I would just say that in Denmark, 2 weeks ago, the government made a decision after a huge emphasis and a lot of debate and discussions in the board that I was talking about, that in 3 years from now, chronic patients will be offered digital health as first choice. And I think it's a huge step. Then this will, be a case study that what happens in these 3 years and beyond that. So, but it's very interesting to follow. I mean, I'm really looking forward to these 3 years, because how do we prepare the people and the healthcare system to offer digital first healthcare in public sector? So yeah, but the future is digital first, and that is what we need to keep in our minds and not stay behind, but stay forward. And then we have talked about AI all throughout the day today. I'll just conclude by saying that before how ready we are in terms of AI, using AI. And it demands that we have proper structured data, which also comes from digitalization. So digitalization also leads to harnessing the power of data, the power of AI as well. So of course, so my conclusion to end is that digital technology is all three. It is both hype, hope, and reality. It is hype when it is overpromised and not sticking to the reality, to the real world. It is hope when we see the potential and we see other examples like other countries who have managed to reach a level where it gives benefits. And it is a reality because already in India we see how big transformations have happened in the last 10 years, and it will continue. So thank you so much for your attention.